Hello,
Hey there.
here we are. How are you?
Good, good. Right on time.
Well, couple minutes late. I apologize, but
Good. You're good. We are just getting started. Yeah, we're just going to introduce everybody. Hello, I'm Teresa Lagerman, Community and Events Manager at the Highlands Current. Um,
sure.
we are very excited to have you, join us today. The Mid-Hudson region today precisely starts phase one of reopening. So it's great to have this opportunity to have the Dutchess County Executive, Mr. Marc Molinaro, join us today. We're going to be talking about what this process will look like and the path forward. I'm sure everyone has tons of questions. You can submit them through the Q&A option that's at the bottom of your screen. We want to, try to get through as many as we can over the next 30 minutes. So without further ado, I'm going to hand it over to our senior editor, Leonard Sparks, who has interviewed Mr. Molinaro several times throughout this shutdown process and gets to do it now live. So over to you, Leonard. And yeah, off we go.
You have to unmute yourself, Leonard.
There we go.
There you go.
Well, first of all, thanks for doing this. It's I imagine for every county executive, these are busy times. So
Thank you. Happy to.
And first thing, obviously the Mid-Hudson region has been cleared to open effective today. And could you give us an overview of what reopening means and how the process will play out over the next month or 2 months?
Well, I would offer to you that looking and projecting too far into the future is probably not wise. We've learned during this pandemic, really more than really any other emergency, how quickly data, information, and policy has to and will change. That said, so, today is both a real reopening and starting of a process. It is also very symbolic, and I think both are important and valuable. So today, the Mid-Hudson region takes that first step of the reopening as defined by the state of New York. Will you and I see massive changes? Perhaps not, but a lot of people are now going back to work. Manufacturing, construction, agriculture, which we've seen some activity already, wholesale trade, and retail can begin the process of reopening. In the case of retail stores of any size can now engage in delivery, curbside, or in-store pickup. And I advise Main Street businesses in particular, that in-store pickup or that pre-order could very well be someone who pulls up to the curb, calls you from outside and says, I'd like to buy something inside, and then meet you inside to do the transaction. It's all permitted. So I do think for as a community that this initial step is really important. But I will also offer you economically about $2.5 billion worth of economic, development projects, construction projects that have been on the sidelines for these last 2 months will now begin again. And that's hundreds upon hundreds of jobs in Dutchess County. Manufacturing represents thousands of jobs in Dutchess County. And of course, retail, in many ways, our small retailers are the backbone of main streets all across Dutchess County. So things won't function exactly the way they have, and we'll need to adapt. I'm confident, despite the challenges, that those businesses who have weathered the storm will figure out a way to adapt. We want to support them. And as we've been saying, as critical as it is that we continue to work to save lives, it's equally important that we work to get Main Street back to life. And that's really going to be our focus as we begin these next phases. To answer the question I wasn't going to answer, I'll answer it anyway. And that is to say, I'm not good at ignoring questions. Outline that these phases are to really be they're to be in 2-week increments. So the very worst case scenario is that we begin phase 1 today and phase 2 then occurs 2 weeks from now. The governor has also said publicly, and I'll offer you in conversations that have occurred privately, has reassured that perhaps those phases will come in less than 14-day increments. And the way I see this playing out is if we continue to meet those benchmarks, we've met the mission, which is to flatten the curve, in particular of hospitalizations. that's been achieved. If we hold those numbers, and I'll answer any of those questions with
Sure.
any detail that you want. But as we hold those numbers, I think what you'll see is the phases that have occurred subsequent to each other in other regions, meaning the Capital District and upstate New York opened phase 1 a week or two ago. I think you'll see over the course of time, those phases will merge so that all of the state is functioning, perhaps except for New York City, functioning about at the same in the same increments. So perhaps phase 2 for us may be 2 weeks, but maybe phase 3 is shorter because phase 3 will have been achieved quicker in some of the northern counties. So I think the way you'll see it is there'll be this convergence of both dates and phases as we hold firm with those lower numbers.
Now, when we say reopening, I think people get this vision that the doors will be flung wide open and we'll be back to where we were pre-March. But there are obviously there are mandatory guidelines and there are suggested guidelines for businesses, and there are going to be some restrictions. Can you talk about some of those? What some of those will be?
First, I agree with you and want to remind folks that it's, this reopening is neither a fling the door open and go back to the way it was, nor is it going to be this continued cryogenic freeze that we've been in. And I say that respectfully. I think a lot of people have been sort of holding, in a sort of a holding pattern, hoping and of course worrying that they can get a job, get back to a job and get a business open again. So, we know both ends of that conversation. And what I offer people is that the fear that some have that maybe we're moving too fast, and the anger that some people have that we're not moving fast enough, those are both valid emotions. I don't dismiss either, and I don't think anybody should. I think there's credibility and validity to all of it. Mm-hmm. Our goal, and that is both at the local level, state level, and otherwise, is to try to mediate and sort of navigate all of this in a way that's safe. As we have said many times, as fast as safe as possible. And that's really the focus. How quickly can we get back to restoring activity while holding firm to the need to be safe and keep people healthy and safe? So, you're going to see some restrictions and changes. So certainly in phase 1, just the very concept, right, that retail can function curbside delivery or in store, that's going to limit capacity. As we get to the next phases, some of the more public-facing businesses like restaurants, bars, social events or event activity-related businesses, all of that is going to look slightly different with the goal, with the restrictions that are likely to be, and the state's offered some direction. We have as well, the county health department, lesser capacity under a roof and in interior, perhaps broader access exterior. If you're a restaurant, maybe expanding your outdoor seating into spaces that you may not even own. There might be shared spaces with other businesses or municipalities. Likely staff, certainly vulnerable staff, will be encouraged to the extent possible to work from home. And of course, in some businesses that's not possible, but where it is practical, that's going to be continued as an encouragement. Face coverings will be likely for at least jobs that you might come into closer contact with a customer. Perhaps it's plexiglass or divider or face sort of shielding between office cubicles and desks and what have you. And maybe some of this, in particular in professional offices, will continue under appointment as opposed to simply walking in and wandering the halls. As we get further down the road and into the larger event kind of businesses, wedding venues, movie theaters, gyms, I think that's one where hopefully we're far enough down the road that we've seen the numbers plateau, stay low, and perhaps there's a sort of a greater return to normalcy. But I also think that is the business, class, if you will, the phase that you're going to see the most noticeable differences, because again, in those kind of settings, it's likely that there will be continued encouragement for lesser capacity, broader space amongst people, and sort of that, because you're in like a theater setting or an event setting, there'll be even more, disinfectant and what have you. I do laugh at times because we've been advising businesses that some of the things they should consider is like, cleaning the bathrooms more regularly. You hope that some businesses were doing this to begin with, but in certainly like an event venue, You might have, for instance, those facilities cleaned after every use as opposed to what you're used to, which is every so often.
Sure.
So you'll see that kind of impact. But again, the goal here is to keep people from getting sick. And if we can keep that rate of transmission down, we'll be able to at least, restore some normalcy. But we all encourage that you continue to use face coverings and engage in the physical distance.
Now, we have a viewer question, and this sort of dovetail right into what you were just talking about. How do you expect to oversee that social distancing rules? And I would add to that because there are other, obviously, mandatory guidelines that have sort of been put out there. How do you expect to oversee that those are being followed by businesses throughout the reopening?
So first, any business that is reopening is supposed to complete sort of a basic safety plan, if you will. You can find that at the Empire State Development Corporation website or at dutchessny.gov. If you go to our link, you'll go to our page. You can find a link to ESDC. The number one, businesses have to affirmatively attest that they're employing these practices. I offer this because while it's not going to be filed with the enforcement office of the public health departments or the attorney general's office, it is a document that businesses will be held to if and when they may be inspected by the health department or otherwise. And I offer to you that businesses are often inspected by the health department or otherwise. So this is not an unusual activity. We do it all the time. So just making that first self-affirmation and attestation is important as a sort of self-policing. Second, these orders do have the force of law. I know there are some who obviously are angry and question the validity of that, but under New York State executive law, Article 2B, executives like me, the governor, the mayor, or town supervisor in a declared state of emergency are provided certain powers to restrict certain activities, and they do have the force of law. And of course, the state authorities, regulatory agencies, along with the Attorney General's office, has the capacity to enforce those, as do health departments and building inspectors and others. But what I would encourage is, one, self-adherence, and two, a degree of consideration. And what I mean by that is these are not the kinds of rules that are easily enforced. And by the way, when enforced, are not easily accepted. And so there has to be a sensitivity to that, which is self-policing, meaning, make the extra step. I offer out loud, and I say this very candidly, this is your consideration of public health is not a political statement. And I really encourage people to set aside the ideological differences that we might have as it relates to whether or not one wears a face covering or engages in physical distancing. Here's the thing. We can remain socially and emotionally connected while still being 6.5 feet apart. It is possible to do that. There are real people who have gotten really sick and some who have lost their lives. And it is an act of selflessness to do our best to not transmit a disease that we do not have either a vaccine nor a therapy for. And so we encourage it, and we ask people to be considerate of that. But I really want to also discourage residents from some of the more, how shall I say, aggressive things or actions that people have taken to shame or to embarrass or even physically to confront someone who isn't wearing a mask or isn't engaged in social distancing. Now, mind you, politicians are used to people coming up to them very close, but I would suggest that this is not the time that you should be doing it on your own, right? There's no need for close talking. Right. But I say that, and I mean this quite sincerely, encouraging someone to wear a mask or face covering is one thing. Shaming them off the sidewalk, or videotaping them and saying that they should be ashamed of themselves, which perhaps no one watching has ever thought of, but is happening across the country. I just don't think is appropriate, and it's not necessary. The same is true on the other side of that coin. Shaming someone who is wearing a face covering is equally inappropriate, and quite frankly, I discourage you from doing it. If someone makes that personal choice, then bravo to them, and they ought to be respected for it. We're living in a time where I would hate to say this, there are probably a lot fewer right answers than there are wrong answers. And so if one wants to take those steps, let them. That is appropriate. If you're not wearing a face covering, then we encourage you to remain at some distance from people. And if you can't, we'd ask you to wear a face covering. And so that's how we will enforce it the way we have been, which is messaging, promotion, and encouragement to do the right, considerate, and selfless thing. But there are steps and tools that can be used to enforce those rules. We just hope we don't have to employ them.
Okay. And
long answer to a short question. I apologize.
No, that's fine. Another question. Can we get actually that's I'll do that one next. But
whatever you wish. Yeah.
This one, would we? Because I think this again dovetails into what we're talking about. Would we be able to switch gears if the numbers turn for the worse?
Well, switch gears is probably, I mean, black and white switch gears is almost easier, although more devastating than sort of dialing it back. So what I mean by that is, and the governor uses this term about using valves, right? The valves open, the valves close. I will tell you that no politician has any good analogy for any of this. So, so I caution people when they hear us talk about this in some sort of, using analogies. The short answer is yes. Every day, our public health department with the New York State Department of Health, and then with these established regional control rooms, meaning local county leaders with the state leadership, every day we are meeting to look at those data points. Some of the benchmarks the state uses, independent of one another, are not terribly useful, but collectively they all are. And in particular, new hospital admissions and hospitalization. And these are numbers we've been monitoring since the onset of the pandemic. Mm-hmm. We're monitoring them daily. And if they start to trend in the wrong direction, yeah, perhaps phase one, instead of 7 days or 10 days or 14 days, becomes 10, 14, or 20. Phase two may be frozen for a period of time. And maybe if we get to a point where we're concerned about numbers, there may not be large social activities or gatherings, and you might delay the implementation of that. The hope is by taking those kind of steps, or maybe even looking at some businesses that become approved. I hate the term essential versus not essential, because frankly, in my estimation, every job is essential, every business is essential, and everybody is essential. So you might identify a business that may be allowable now that maybe you'd want to scale back a little bit. The hope is that none of that's necessary, that a slow, steady progression through the phases keeps us during this weather. And by the way, this weather does have an effect on the transmission of the disease, in part because we're not on top of each other in sort of close proximity in office spaces, what have you. So that said, the hope is that if the numbers continue, we can just progress through these stages. The biggest concern anyone has is a big spike. And so I'll end where I started, which is a massive spike could require the nation, the state, to consider just we're going to freeze again. That would be devastating economically. It would be devastating from a community and social perspective. Also, I would assume to some degree from a psychological perspective. But that is possible. Is it likely? No, it is not. I think that we've learned enough about the disease, and we know enough about our capacity to kind of slow the transmission, not without people getting sick, but that we can make smart choices moving forward, and that's really the goal. And every day we're monitoring those. Be sure we are.
And we have this control room that you and
it's a bit of a misnomer, but go ahead.
Yeah, well, I don't know who came up with the name, but what's Mariella Nodell, Putnam's executive, they're all part of this, and obviously we have the executives from the other counties that are in Mid-Hudson region. What's the control room's role in all of this?
Well, as I said, this is the governor called it. I mean, it's more of a monitoring room. I mean, that's how I refer to it. There are the 7 county leaders meet with state officials to talk through whatever new announcements came that day. And I say respectfully, sometimes we don't know, and I'd even argue the governor's staff, or the folks from the state on the call don't know what's being announced until it's announced. I would offer that if I were to be critical, that's one of the things I'd be critical about. But at 3 o'clock every day, except for this past Sunday, but every day at 3 o'clock, we review any new decisions made at the state level, businesses that move in those categories with ESDC from, again, non-essential to essential, not a term that I like, but it's the one they use. We review those benchmarks and the numbers as to where we are, and then we ask dozens upon dozens of questions. If someone's watching and thinks that the county executive of Dutchess hasn't yelled loud enough in public or isn't fighting hard enough in public about something that you believe or feel, I can guarantee you that we have in the context of those meetings. I think that this is a time for calm publicly. I think it's a time to be very direct with the public publicly. But that doesn't mean that we aren't having very pointed conversations privately. And that's not to suggest that it shouldn't happen in public. It's just, or that these things are somehow confidential. It's just, that's our time to really present our concerns. I mean, for instance, this ongoing saga about whether or not we would meet certain benchmarks at a certain period of time, became a very heated and very adversarial conversation. Ultimately, it resulted in us meeting those benchmarks and the state moving forward with phase one. But here's a for instance, there are plenty of restaurants who want to know when they open, will they have to be at 50% capacity inside or less or more? Still no answer. But I can tell you it has been a constant beating from the local elected officials to the state officials that we need clarity. It doesn't need to be that we need to know everything ahead of time, but we need businesses to get ahead of time. Large businesses, here's one in Southern Dutchess, Splashdown. Splashdown has to spend $500,000 to open on day one. Under these phases, they could likely open under phase four. Here's the thing though, no one has said that they are clearly going to be permitted. So our position is, say if you're going to permit them or not. I mean, for instance, if there's not going to be any of these kind of amusement businesses, they need to know that today. And if there is, they're going to open in phase four. Then they know that in 30 days, having spent $500,000 won't have been a loss. But you can't tell them a week before phase four begins that they're going to open up because they'll never open. Again, these are all very important decisions that need to be made, but that information needs to be clear. And we're using those control rooms as a moment to articulate. I've been fighting for special education and support for those with intellectual and developmental disabilities, just a timeline and access. So it's a very, listen, control isn't the right term, and there are moments where I'd offer to you that it's a bit of a farce, but I will offer it is very valuable a venue to have very open, very candid, and sometimes very heated conversations. That's our job, and then we go off and do our jobs.
Now, can you give us an update on the situation with nursing homes and the testing, both the testing of residents and the testing of staff?
As you know, Dutchess and Ulster began this regimen of nursing home testing really ahead of other counties. We started 3 weeks ago now. There was a hiccup. The state had guaranteed access to testing kits. That was a bit delayed, although they came through. And then Wadsworth Lab, which is the state-run lab, had to in fact decline taking new tests for a short period of time, but the state fixed that very quickly from one of our control room conversations. So we are nearly done with all patient testing. We'll have some more information on the final numbers likely I expect by Friday of this week. We'll know more of that. I will tell you that we are very optimistic. The data that we have so far, and we released the first round of tests, I think a week ago, actually suggested that our nursing homes are doing relatively well, that the staff there is really keeping the transmission to a minimum. There were very few total positive cases as a percentage of the whole, certainly not what we've seen in other counties and other parts of the state. And that's not to say that, that they're doing anything poorly. It's just, I think that our nursing homes have done a remarkably good job at managing. Now, the stress that's on them is immense. The governor, as you referenced, 2 weeks ago issued an order that requires all staff to be tested twice a week. I only have, and this is only off the top of my head, only have one round of testing completed, and generally it was very positive, very, very few unidentified positive cases. We'll know more as we get later in this week, and as I said, by Friday we should have some updated information.
Now, we have a couple questions that are both sort of a little related. Both are about the federal government's role in this, and one question is, how has the federal government helped, and what more would you like them to do for the county, when? And the other one is there are mixed messages from federal government, but county executives and states seem to be taking it much more seriously. Why do you think that is? So I'll let you have at them.
Well, so I'll merge those two. The question of when we need it, yesterday. We needed
Yes.
federal aid yesterday. And what I'd offer, so again, I apologize, this will be a bit of a long answer, but let me,
That's fine.
I think I get both of them pretty quickly. First, the federal government has to step in. This is not a request by anyone for a bailout. I mean, understand that in natural disasters and emergencies for generations, although with some political bickering and debate, the federal government comes through. The reason they come through is because it's their job. The federal government is supposed to step in particular in emergencies, when the demand exceeds the capacity of the local level, the state level, and then the federal level comes in. Just so we're clear, in Dutchess County, we are looking at as much as a $75 million loss in revenue and added expense. That is the added expense of responding, and that is the loss in particular of sales tax revenue. That is a result of obviously this pause, this closed down and frozen state that we've experienced. But also, let's be realistic. Even if certain things were open, people would have made very, very pointed decisions not to be out in certain public venues and settings, and so the governors all across the country took the step of closing or not, depending on which state you're in. But I think the public would have made some pretty stark choices as well, and that would have resulted in sales tax losses. But nevertheless, these 2 months of this frozen state has had an enormous financial impact on local governments. So I'll answer the second question, which I know is a bit more political, but I think it's important to also frame it. Local government is where emergency response begins. And I think that oftentimes we think that the president, any president, is supposed to come in, declare something, and be helpful. What I'd offer to you is that it is almost always the reverse. A fire breaks out at a house, obviously the president's not coming in to help. It's the local fire department and the local community. If there's a flood, it's the city or the neighborhood. If there's a hurricane, it could be several communities banding together and counties banding together. And as the demand exceeds the capacity, the next level of government steps in an emergency. So all of that said, county governments were the tip of the spear for this response. 1,900 health departments run by county governments across America. So in a public health emergency, it is in fact the county government that effectuates the outcome. Mm-hmm. So whether it's the president and the coronavirus task force, or federal, or the Congress, or the governor, or the state legislature, when they were talking about accessing testing or doing antibody testing or contact tracing, it is county governments that are the ones effectuating that outcome. And this is unique in that sense. If there's a local, a hurricane or a flood, it could very well be the city mayor or the town supervisor who's responding. We had those what do you call those, microbursts a year ago. Yes, the county provided back, support, but it was the municipality that responded, right? They came to the aid immediately. So I just offer that in any emergency, it always begins at the local level and then expands beyond that. I think that, quite frankly, the federal government made too many political decisions and didn't necessarily understand how broad and how deep the impact of this particular crisis was or would be. And I think that they didn't realize how weak how weak and shallow our access to PPE, to testing, and to distributing those things across state and across county and state lines truly was. And so, this federalism that we enjoy was really on full display. States, didn't have access to certain things. They expected the federal government to, local governments expected the states to, and that was exposed. And I think looking back, we better have learned from that. So I hope that answered a little bit of all those questions. For me, I sort of take the governor's approach in this regard, and that is that our job is to respond, and when it's over, then we'll consider the politics of it all. But in the midst of responding to an emergency, and we still are, I need the federal and state government to work with us, and you need me to be able to work with them.
Okay. And we have another question about summer camps. Do you anticipate summer camps will run? And if so, what will they look like? Or what would that look like?
So ordinarily, Dutchess County's health department would permit a summer camp. We do that every year, all the time. We've advised those institutions that run either overnight summer camps or municipalities that do day camps that we are comfortable evaluating their safety plans and permitting them to begin in the month of July. That would correspond with about phase 4 of the stages, right? These opening phases. The governor, however, has withheld the approval for those. He's undecided as to whether or not those will become essential.
Mhm.
So at the end of the day, the governor gets to decide that that issue under his executive orders. If he permits them, we are prepared. If he allows them, we're prepared to permit them. There are a couple things to keep in mind, and again, I don't, I am informed by doctors. The county's commissioner of health is an infectious disease doctor, and of course, we're informed by data. But I am not a public health professional. Just take that information and try to distill it and make decisions based on it. But we are comfortable permitting camps so long as anyone who lives with or is a vulnerable population should not participate. We think that that is a reasonable initial step. We don't want you to be a vector or transmitter of the disease back home to an ailing parent or senior who perhaps lives in your household. So those kinds of decisions need to be made up front. That's the camp and the guest, the customer, if you will, need to make those choices. Extensive disinfectant and cleanup would have to be engaged in. So as I said, sort of those steps that you take for granted, maybe you're cleaning once or twice throughout the day, you're probably going to be cleaning, every hour on the hour. To the extent we can, we don't think individual children can social distance. But we think the staff should be, wear face coverings where appropriate, and then activities that would limit, massive group interaction. So maybe it's splitting the groups into smaller groups or what have you. Maybe it's crafts at one end and some other activity other. What we do know is this: we have had very few positive confirmed cases among children. I'm not going to give any scientific or medical information. There are some who believe that the ability among young people to transfer is limited. That said, we also know that young people are less likely to have identified the symptoms and may never have come forward to be tested to begin with. We have very few hospitalizations of individuals under 18 years of age, although there are some, and even fewer deaths related to COVID-19. We do think that, again, there is always the assumption of some degree of risk. That young people who are aware, who engage in the cleaning, maybe it's hand sanitizers, what have you, and then limiting the vulnerable populations, that we think that camps can function. The other is, and I'll end with this, there's an economic reality, and that plays into our decision making. As businesses reopen, and they need to because people need to go back to work and pay the bills, there will need to be some alternative, some support structure for families who don't have it otherwise. And so day camps and summer camps are that outlet. And so, again, some of the economic benefit has to be weighed against some of the public health risk. And then we need to find that balance between the two.
We're going to do one last question. I
can stay with you for a few minutes longer if you wish.
Well, I mean, what we'll do before we get to the last question, and just to go back to the question about the federal government, I mean, do you think it's likely that Congress and the president will agree on some kind of aid package for counties?
I didn't, in my very long answer, get to that. So thanks for asking. I do. I think that there will come some agreement on assistance for states and local governments. It'll likely include a lot of other things, as Congress and bills out of Washington often do. But that's the way it gets done.
Sure. Yeah.
But I will. Let me say. I'll say two things. One, I think that it will because it's necessary. At the end of the day, what the federal government, and I'd offer in particular this president, does not want to have happen is that we begin this economic recovery only to have massive government layoffs to follow. Like it or not, government employees do get paychecks. and those paychecks support families and they support businesses. And so have a massive downsize of government at any level is economically and socially, emotionally, and personally devastating. So we would not have a recovery if it is met with government downsizing only in the next several months. So I think from an economic argument perspective, there's certainly needs to be some aid there. Again, I sort of made the political argument, which is this: the federal government, again, bicker and argue. That's what it does. That's what Congresses do. Legislatures do. That's how it works. They argue. Eventually, they come to agreement. The federal government has never stepped away during a time of crisis. And at the end of the day, somehow summon both the political courage and the common sense necessary to develop and deliver real aid to keep the emergency, the response to that emergency, to keep it from being worse, keep the cuts from being deeper and the hemorrhaging from being broader. And I believe that they will do that. So again, economics and sort of the standard commitment that the federal government has made in the past, I do think concludes with some aid. That said, you know that the House of Representatives adopted what's referred to as the HEROES Act. It has a lot of stuff in it, and I'll let all of you debate what of it is necessary or not. I think a little bit of all of it is probably necessary.
Yeah.
It does include direct aid to states and county governments. That particular bill, and Congressman Maloney from this end of the district of the county, at his district, has sponsored and made the argument, and those dollars would keep Dutchess County, if adopted exactly as it is. I would say we wouldn't have to downsize at all. That particular bill would make us pretty much whole, with some pain, but pretty much whole, and sustain us for the next 24 months, which is what we need in order to rebound. The Senate will come up with a different version, and they'll debate and negotiate this between the two. And I do think they come to some conclusion. But as I said, we're staring at as much as a $75 million hole in our budget. That's almost twice as much as the budget gap I came into office with in 2012. And that required 100 job downsize at the time. So again, I think it will happen. I ask you to encourage Congress, Republican and Democrat, to step forward. I say to my Republican colleagues, this is not a time to play politics. I don't care if you don't like the governor. There are reasons that I wouldn't like the governor at times either. But I don't care if you don't like the governor. I don't care if you're not from a blue state, and I don't care if you don't think that the state governments are as effective or responsible with your dollars. When you hand them over, you should have caveats. There absolutely ought to be accountability, and there needs to be a direct link between need and resources. I say to my Democratic friends, now's not a time to exploit that either. And again, just handing cash when you don't have it isn't a good idea either. So come to some compromise, find the right balance, and do your jobs. And your job at the end of the day has been articulated by our congressman and others, is to give us the lifeline we need to sustain our core services while responding to what is an unprecedented economic and public health crisis.
Now, I talked to a business owner today, and she was telling me that she was still sort of in the fog about the guidelines and for reopening, and she was saying that that's been one of the questions that a lot of business owners have been expressing that on a particular Facebook page. So, what's the county's role in trying to, because obviously you guys are, again, as you say, on the front lines. I mean, what's the county's role in sort of being sort of a go-between, between the businesses and this information, and what are you doing to help businesses with the whole reopening process?
Well, that is a really long question.
Okay.
So I'll offer. You described it. We're sort of the mediator. We're the middle. Sort of the bridge between layers of government. Number one, I will offer that it is confusing, and it shouldn't be. We've articulated this, and I've argued it in those control rooms. The state has not been good at getting ahead of the decision. So the decision gets made, and then the protocols seem to follow. This is not that time, and that can't be the way we progress. In theory, the state of New York, because it is under the governor's order that businesses are closed, right? So under that executive order, is developing guidance and guidelines. Again, you can find at Empire State Development website. You can visit that by coming to, or go there by visiting dutchessny.gov. And there are guidances. There's an explanation as to what businesses fall in what category and what basic expectation you should have in planning to reopen and ultimately reopening. And the affirmation, that attestation that's required, that says that you have a plan. So the county plays sort of that intermediary informative role. And again, at dutchessny.gov, you can find a lot of basic information for businesses and the public. I'd also encourage businesses, if you've not already, to join dutchessbnn.com. It's Dutchess Business Notification, bnn.com. Mm-hmm. We have 9,000 businesses that have signed up. Every day you will get an update on what's new today, the governor's new announcements, any new protocols, any new guidance with the appropriate links, information and questions that you may have, access to purchasing PPE. All of that is there. So if you're not signed up for it, I really encourage businesses to do that. I think it would be very, very helpful for you. In the meantime, what the county has done is assisted in PPE purchasing with our local chambers of commerce. We're using them as the mechanism to get to our businesses. If you're not a member of a chamber, I apologize, but join bnn.com. It's free, dutchessbnn.com. You'll have access to that same basic information. We have launched a small business loan program. If you don't qualify for the federal aid, you can, through Dutchess County's Industrial Development Agency, apply for a small business loan. We recognize that some people don't want to hear anything about a loan because they have to pay it back, but perhaps this is enough to bridge a gap for a period of time if you're open again. The other is that we continue to support businesses through Think Dutchess, which is our Alliance for Economic Development. Assistant County Executive Ron Hicks has been tasked from day one with being that go-between for businesses. So you should reach out to us with any question. We'll try to get you some answers. That's our role, and that's also, I guess, what I would offer to be critical is the state needs to be better at very clearly articulating what those phases, steps, and guidances are ahead so that you can make plans. The other thing I'll warn you, and it goes without saying, but I'll say it anyway. As much as I love social media, and I actually do, I think it's it's both ugly and beautiful at the same time, and it's a great way of communicating. There's a lot of airing of grievances on Facebook, and a lot of times that information isn't always complete, accurate, or sourced in any particular way. And so use it to communicate. To the extent I have time in my day, if you tag me, I'll be happy to try to give you a link or give you information. Sometimes people yell at me because I give them information that isn't what they wanted. But we'll try to be as responsive as we can. But always go to the sources, and dutchessny.gov and Dutchess County's Facebook page is a good place to get sourced, detailed information. And I get the desire to air one's grievances on social media, but a lot of times that information is becomes so either saturated or decentralized that many times it's, by the time you're the 17th commenter or 117th commenter, it may not be accurate. And it's like a game of telephone, right? The message gets blurred as you get through the day.
Sure. One more question, and this is maybe political, but it's someone wants to know, has this situation made you think about running for governor again?
It hasn't entered. I mean this sincerely. It hasn't entered my calculation in life at all. I will say out loud again. Our job at this level of government is to respond, and so whatever is in my political judgment is immaterial, and I've attempted very desperately not to have it influence me. Which is why, by the way, at times you've heard me be very complimentary to the governor, and at times. Not harsh, but critical. And I think I think that's necessary for all of us. And some of you watching or listening have been both complimentary and critical of me. And that's fine. That's the way it's supposed to work. What I will offer to you is that when this is all over, if there isn't, when it's all over, when the emergency has been lifted and we're responding in a different way, we ought to look back and we ought to be critical, as we would in any emergency, and evaluate what we did well, what we did poorly, what went right, what went wrong, and we better learn from it. Because not learning from those experiences, missteps, or successes is a missed opportunity. And all politics aside, that is absolutely necessary for leaders. And any leader who doesn't admit to fault or mistake or doesn't acknowledge that there were missteps isn't leading. They're misleading. And so I offer to you that all politics aside, that's our goal. Right now, as I said, we have a job to do. My wife joked with me very early on that every so often, even you, Mark, she said, are essential.
Well, that's good.
He's my harshest and most honest critic. We're all in this together, and I mean that not in a cliche way. We all have experienced this in different ways, and again, I really want to reinforce. I know the human toll of this disease. I know it personally. I never expected to have experienced it, but I did. And so it's hard for me to accept people who argue that this was some sort of hoax. It wasn't. It isn't. There are people sick and there are people dying. But it is equally hard for me to accept those who think that we just remain in this state of frozenness because it's just not. It's not going to happen. It's not practical. It's not logical, and we can't. So finding the right balance requires that we cast aside partisanship and politics and just try to make smart decisions. And when we make bad ones, as Franklin Roosevelt offered during the Great Depression, just try again until you get it right.
Okay, thank you. Well, I want to thank you for being here, and I think it's going to be dinner time. So
For you maybe.
So Teresa's going to come on and wrap it up. But really, thank you. It's been great.
Thank you. And let me say to everyone who stayed on this. And to you at the publication, you're all essential, and I mean that sincerely. What the media has done in particular over these last several weeks has been Herculean, trying to distill information in a way that people can understand it and digest it. In some cases, even accept it. You've had to ramp up your understanding of public health issues and match it with economic concern and communicate it in a way that the public can see it. Local media even more so than any other. I mean that sincerely. There's a reason that there's a constitutional amendment that provides you the job that you do. But the closer the better, meaning more local, the more informative, the more helpful, the more trusted. And so opening it up, many local media has made it free to access COVID-related information. You, of course, continue these kinds of conversations. I see on social media as well. It's really important that the public knows where to turn, and I think the closer to the public, the better, and again, the more credible and the more trusted. And so you've had to take these really massive and somewhat complicated issues and communicate in a way that people can understand it. And to those watching, I'm going to stop talking, but I really want to reinforce this. Whatever you're feeling is appropriate. There's just no one who can tell you that how you feel is inappropriate in some way. Everyone has right to being anxious, angry, concerned, stressed. That is all valid. It is all credible. It is all real, and it ought to be at least given its due. And so, for your patience, residents, for your consideration, for your calm, for your willingness to do things that are nothing we would have thought of doing only 2 months ago, face covering, social distancing, limiting those activities. And for just being good and decent citizens, and I think Dutchess County has proven that we have good and decent people who are just trying to do the right thing. I'm grateful. It's hard enough to live your lives in these unprecedented times, and I can't express our gratitude more genuinely than that. So thank all of you.
Okay, thank you.
Thank you for that, and for taking the time. We know you must be insanely busy, so we really appreciate you taking the time. We'll let you go. You have a family to get to for dinner, so thank you everyone for watching. We hope you enjoyed the conversation, and keep an eye out for the next one in the next few weeks.
Thank you.
Thank you.
All right. Good night, everyone.
Good night.